Hi there, Dr. Marie Donna here, youth and adult psychiatrist here to discuss all things mental health and wellness related. For today, I wanted to discuss why should I take medications for mental health? If you or someone you know is grappling with mental health issues, this video is for you. Remember, this information is not a substitute for personal and professional medical advice, but it can certainly guide you on your journey. If you need personalized information about medications, please reach out to a psychiatrist or doctor. First, let's take a moment to talk about what mental health conditions really are. They're more than just a set of symptoms. They're real medical conditions that affect how we think, feel, and act. Common issues include depression, anxiety, bipolar and mood disorders, PTSD, and psychotic disorders such as schizophrenia. Medications for mental health are designed to help restore the balance of chemicals in the brain. Many mental health disorders are linked to imbalances of neurotransmitters, which are the brain's chemical messengers. Drugs like antidepressants, anti-anxiety medications, mood stabilizers, and antipsychotics can help modify these neurotransmitter levels. It's important to note that while medications can significantly lessen the severity of symptoms, they are generally most effective when combined with other treatments like therapy. When it comes to taking medications for some of these things, I will usually use a metaphor to describe why some people might have stigma or bias against these medications and why I think it's important to continue taking them. For example, when someone has diabetes and they have troubles with regulating their glucose levels or insulin levels, they might need to take medications on regular, ongoing basis. Would you tell someone who had diabetes to not take these medications to help regulating their blood glucose levels? I wouldn't say so. So this is where I'd like to think when it comes to mental health issues, when there is a medicine or something that can help someone manage their symptoms such as depression or anxiety, taking something that would be helpful for them long term would be something that would be included in their overall treatment plan. Now, you might be wondering, am I someone who actually needs to be on medications? Well, here's a short guideline. If your symptoms are significantly affecting your daily life, think about how you're performing at work, at school, or in the home, or how you're interacting with your friends and family. It might be worth consulting with a psychiatric professional. Yes, there are things in life that can bother you from time to time when there are circumstances, situations, or things that might stress you out, but this is more along the lines of an ongoing, consistent issue where even after you've tried other things, behavioral interventions, things have gotten better and the circumstance, situation, or stressor has been relieved, that either the depression or anxiety is still ongoing. This is when I would consider potentially starting medications. I always encourage people to have an open dialogue with their mental health professional or doctor. This can help assess your symptoms and work with you to formulate a treatment plan, whether it includes medication, therapy, or a combination of all of the above. I think it's important that when you are talking with your doctor or psychiatrist to be honest, and a good rapport is usually something that is very important. If you are not feeling comfortable with the doctor or a psychiatrist that you're meeting with, it would make sense why you wouldn't feel comfortable with moving forward with the treatment. So establishing a relationship and open communication with whoever would be prescribing these psychotropic medications to you is going to be really important as well. There are also a lot of misconceptions about taking medications for mental health conditions. One of the most common fears is that taking medication means that you're weak or you can't handle problems on your own. In reality, choosing to take medications is a brave decision to seek help and improve your quality of life. Another misconception is that medications will change who you are. When you are meeting with a proper psychiatrist or doctor who knows how to manage medicines should never change who you are as a person. They should only help optimize you to be the best version of yourself. If there are any concerns when it does come to taking medication or side effects, this is where this open dialogue with whoever is helping you manage your medication regimen and dose will correspond with you to, figure out whatever the problem is and to make sure the medication is right for you and at the right dose. It's important to clarify that the right medication can help you feel more like yourself by alleviating symptoms while allowing you to continue your life without overwhelming challenges. Finding the right medication is often a journey. It may take several appointments and trials of different medications and different doses to see what works best for you. And also, when starting a medication, There might be some allergic reactions or adverse effects or side effects, and it is essential for you to communicate with your doctor about any potential side effects that you might experience. And this, again, where it is very important for you, whoever is prescribing the medication to you, a psychiatrist or a doctor, to feel comfortable to have this open dialogue so that you are able to receive the best treatment for you. And remember, just because something worked for your friend doesn't mean it will work for you. I will say that sometimes there is a genetic component to mental health conditions where if a family member has benefited from a medication, that's where it might be helpful for you. But just note too that at the same time, every individual responds differently to medications. And this is where, again, open dialogue and communication when you are considering taking these medications is at utmost importance. In conclusion, mental health medications can play a crucial role in improving the quality of life for those facing mental health challenges. However, taking medications should just be one component of a holistic approach to mental health. Eating well, staying active, and getting enough sleep, and seeking therapy or other behavioral interventions are vital as well. I am a psychiatrist, but I will always emphasize that it's not just medicines. Medicines can play an important and crucial role overall benefiting your mental health, but it's not the only thing. This is Dr. Maridana. Continue to follow our channel for more mental health tips and overall wellness tricks as well. Have a great rest of your day.